So let's start with, again, a few numbers that really kind of brings some perspective to sleep. So first off, 1 in 3 adults in the US get less than 7 hours of sleep per night. And according to the CDC, that's a deficit of sleep over time. So it means that basically every third person who walks into the clinic is probably under-rested before they even start the session. So kind of keeping some of that in mind. Somewhere between 50 and 70 million Americans live with chronic sleep or wake disorders, and believe it or not, that's actually on par with the number of people living with things like diabetes or hypertension. So it's quite an impressive number. Yet, where we may take vitals and we'll do chart reviews and med screens, like this sleep may not be something that we're regularly screening for how prevalent it is as far as quality goes. So, of those 50 to 70 million Americans, about 10 to 15% meet full criteria for an insomnia disorder, meaning persistent trouble falling or staying asleep at least 3 nights a week for 3 months or longer. Even further, what's pretty crazy, I think, is that upwards of 80 to 90% of these folks go completely undiagnosed. So most people struggling with poor sleep never actually receive that formal support that they need, and we may be the first people who identify it, but we certainly have the opportunity to. All right, so as far as like some overlap with particular patient populations that we see prevalently, upwards of 40 to 70% of people with chronic pain also have insomnia or significant sleep disturbance otherwise. And this is no news to any of us who have been working probably more than a day or beyond our clinical rotations from school, that we know that those in chronic pain have difficulty sleep, and that there's a bidirectional relationship with poor sleep quality and turning up the volume on intensity and ease of pain and other symptomology. So we treat pain all day, and we often skip the thing that either can amplify it again or alleviate it, and that's sleep. Like, that's how people get better sleep. Let's assess this thing and be able to talk about it intelligently. So even when patients do have, chronic insomnia, again, just we're looking at only 12% getting a formal diagnosis, which again is pretty crazy. So the vast majority of these cases are just flying under the radar. And even further into another disorder that we all are familiar with, obstructive sleep apnea, or OSA, is incredibly common. Estimates vary globally, but most data show that over 80% of adults with moderate to severe OSA remain undiagnosed. So another high prevalence as far as those folks who aren't formally diagnosed or being treated, where we can be that first person to help, highlight this as an issue and help these folks out. So when your patient tells you they're always tired, maybe their spouse comes in, or they tell you themselves that they're a snorer, or that they need a nap after work, or a daily nap for that case, those aren't just throwaway comments just to say oh yeah, I get tired too, or yeah, I love naps, or whatever it might be. These are indicators to say, hey, maybe we should ask some curious questions. So all this adds up to this national burden when we think about how prevalent these insomnia and OSA cases are in regard to work productivity, how sleep deficits impede our health in other ways. And so there's some data that suggests that upwards of $411 billion with a B dollars per year in lost productivity, increased medical costs, downstream health impacts from sleep quality deficits, which is just insane. So, another step to go along with that, this is more than we spend annually on cardiovascular disease, which just seems nutty. So, sleep, super important to think about and consider seriously.